landscapes attract tourists from all over the world. But Coniston is also home to 1,000 full-time residents, and this is their doctor's surgery.
Good morning, everybody. George?
Or, as George puts it, their lifeline.
They don't serve us with medication and treatment, they care for us. There are hundreds of people here who are living in fear, constant fear that this surgery is going to be closed. And if it closes, we don't know what we're going to do.
I think we were going to do a blood pressure check.
The government's about to scrap a special fund available to small surgeries like this one. Here they estimate it'll wipe a third off their income. The doctors have taken a pay cut, but they still can't balance the books.
Small rural surgeries do need additional funding because they are much more expensive to run, and people who live in rural areas shouldn't be discriminated against for doing so. We are extremely concerned about it because what we are obviously thinking about is whether our surgery will still be viable.
We're receiving reports from practices up and down the country, both in rural areas but also in cities. And at one level, there will be a reduction of services because practices will need to have fewer staff, maybe some surgeries will be cut, they may actually not have the same range of services available. But at the other end, we've heard of practices that simply will not be able to be viable financially.
For many, Coniston's charm is its isolation. There are times, though, when if you live somewhere like this, it's easy to feel cut off. The nearest hospital is about an hour away by car. There is another doctor's surgery 4 miles away, but during the winter, the road to it can become impassable.
That's it, George.
Oh, thank you.
That's why the surgery is also the local pharmacy and a minor injury clinic. As we were filming, this tourist came in after a cycling accident. No one from the Department of Health was available for interview, but in a statement they told us, "We want to ensure that patients have access to high-quality GP services no matter where they live. The system needs to be equitable, so practices are paid fairly according to the number of patients and the services they need."
Thank you very much. Goodbye.
The extra funding was, the government say, always a temporary measure. But for this surgery, it's vital. And without it, George fears the loss of the care he relies on.